Ladies, if you have effed up hormones, this video is for you. Today I'm going to detail the 3 most common forms of hormone issues I see in women. Now, of course, there can be many other different forms of hormone imbalances depending on the person, but I am a physician assistant that works at a wellness clinic. I'm also a health coach, so these are the 3 most common hormone issues I see in women. I will also describe in detail my personal hormonal issues that I had the last couple years and what I did to fix it. Addressing my personal hormone issues has helped me make so much more progress in the gym, so much more progress with my physique in the last 2 years than I did in the previous 10 years combined. So keep listening for that story. Number 1, if you have a high level of stress and irregular menstrual cycles, this may be your issue. Low progesterone. This is so common and I see it in so many women. Reason it's so common is from what we call cortisol steal. Because cortisol and progesterone work in similar pathways, if you have high levels of cortisol, very high levels of stress, it can actually steal from your progesterone, which will cause an overall low progesterone. This is typically the female's body first line of defense. So if you have a high level of stress, undergoing a lot of stress, the first thing your body is probably going to do is make this shift, and the cortisol will increase, progesterone will decrease. Now, I could dive into the physiology behind how this happens, but I'm just going to explain to you what you need to know. What are the main causes of this low progesterone? Again, it's going to be very high stress levels, chronic disease, obesity, PCOS. Not ovulating can actually cause low progesterone. Reason being is progesterone is what's going to increase after you ovulate. So if you're not ovulating for whatever reason, maybe that's PCOS, you will have low progesterone. Approaching perimenopause and approaching that time period where your hormones start shifting can also cause low progesterone. This is very common and again going to be one of the first hormones that's hit when you start approaching menopause. What are the most common symptoms I see with low progesterone? Irregular menstrual cycles, headaches, difficulty sleeping, hot flashes, and especially mood changes. I like to call progesterone your body's natural Xanax. So that being said, if you have low progesterone, you're probably going to have higher levels of anxiety. What are the main solutions to low progesterone? Well, number 1, first and foremost, figuring out the root cause. Like I said before, there's a lot of different causes as to what can cause low progesterone. So you need to figure out either with a provider or with a coach what is causing your low progesterone. Again, there's a whole number of reasons. Most commonly, I would say stress related. Figuring out what is actually causing the low progesterone is going to be your number 1 answer, your number 1 solution in reversing that. Now, if you've went through all of the possible causes, all of the possible solutions for each of those causes, and you still have low progesterone, you could consider progesterone replacement. Now, when I say progesterone replacement, I mean actual progesterone replacement. This is not going to be your hormonal birth control. Hormonal birth control has progesterone, but it's what we call synthetic progesterone. Synthetic progesterone is not the same as actual progesterone and the actual hormone that's in your body. So again, if a provider or if someone wants to throw you on birth control because your natural progesterone is low, that is not an adequate solution. Number 2, if you have gut issues, bloating, and terrible PMS, this is probably your issue. High estrogen or estrogen dominance, it's commonly referred to. Now, this one can be kind of tricky because you do have to differentiate between what is actually high estrogen and what may just be low progesterone, the first issue we talked about. A good way to gauge this is 1, getting more extensive testing like a Dutch test, or 2, making sure you're testing your hormones at an optimal time of the cycle. I prefer day 21, which is the luteal phase of your cycle. What are the main causes of high estrogen? Usually it's going to be an issue with detox or clearance of estrogen. So a lot of times these women will have issues either with their gut or their liver. Clearing out the estrogen is the problem. Typically, it's not that women are making too much estrogen, it's that they can't clear it out and it's building up in their system. Hormonal IUDs can cause elevated estrogen, especially on lab work, and having excess body fat can actually also cause elevated estrogen, as this can convert to estrogen in the body. Now, the other time I'll see very high estrogen is actually towards perimenopause. Now, this could sound kind of confusing because typically you're thinking once someone starts to go through menopause, their estrogen crashes, which is true. But those years prior to menopause, when your body is still trying to push out eggs, but there really aren't any there to push out, your estrogen is going to go crazy up and down. It's going to spike. So you could have a period where you check those labs and your estrogen is spiked, and then who knows, a couple days after, your estrogen could be completely tanked. What are the main symptoms you're going to see with elevated estrogen or estrogen dominance? Bloating, having a lot of water weight issues, increased breast tenderness, worsening PMS symptoms, and then two other symptoms I kind of wanted to go in detail with. Fibrocystic breasts, so cysts growing in the breasts, and uterine fibroids. Why does this happen with elevated estrogen? I like to describe estrogen as the grass. So estrogen causes things to grow. Progesterone is like the lawn mower, so it will kind of trim things down and keep your hormones regulated. So if you have very elevated estrogen, if you have an imbalance of your estrogen and your progesterone, things are going to be growing and there won't be as much progesterone to balance that out. So because of that growth issue, you can see things like cysts growing in the breasts, fibroids growing in the uterus. What are the main solutions to elevated estrogen? Number one, figure out the root cause. You are going to hear me say this over and over again because the thing with really any hormonal issue is you have to figure out what's causing it before you can address it. So for a lot of women, this is going to be figuring out their gut issue. This could be with higher level testing like a GI map, or just really working closely with a coach to figure out what are causing the gut issues, what specific food issues you have, and how you can improve your diet. For a lot of women, if they just cut out processed food, if they just start eating whole foods, lean proteins, and foods that digest well for their body, a lot of this could be cured. Increasing fiber is going to tremendously help with a lot of these gut issues. So again, this will go back to incorporating more whole foods. Cutting out alcohol. This is going to be huge, especially if this is a gut or liver issue. In America, the number one reason for liver issues is what we call fatty liver. It's pretty much what it says it is. It's when you have fat accumulating on your liver, just like you can anywhere else in your body. Having fatty liver and not being able to detox the estrogen is going to cause high estrogen. So obviously, cutting out alcohol, losing weight, and eating healthy is going to be your number one solutions there. Now, a big trendy thing in the functional health community is xenoestrogens. So xenoestrogens are basically going to be these synthetic forms of estrogens that you can see in a lot of our products today. So a lot of plastics, deodorants, lotions. You can see it in a lot of products where we may not have seen this before. Your body can see these xenoestrogens as estrogen in the body, but they are not actually functioning as a healthy, productive form of estrogen in the body. So one way you can try to reduce your estrogen is to cut back on these xenoestrogens, try to opt for more natural products, and avoid plastics. Now, I will say, if you are overweight, if your diet is terrible, if you have gut issues, liver issues, I wouldn't focus on that as the main solution. Focus on what you can do to lose weight, get your body healthy, and of course, cutting back on the plastics and the products that contain these xenoestrogens can be helpful, but that may not be your number one driver for high estrogen. Number 3, if you have low energy, no sex drive, and you've spent many years on hormonal birth control, this is your issue. Low testosterone. Now, this is something I personally struggled with for about 2 years after coming off of hormonal birth control. I had been on hormonal birth control for about 12 years prior, which that in combination with many years of chronic dieting, I think caused my issue of hormonal imbalances. I'll detail this more after I describe a little bit about what low testosterone may look like for you. So again, what are the main causes of low testosterone? Hormonal birth control is a big one. Anytime you're taking synthetic estrogen and progesterone, which is what hormonal birth control is, there's a chance your natural testosterone levels can decrease. Chronic dieting can cause low testosterone. So if you've spent many months or years eating low calories and being in a deficit, you could have low testosterone. And thirdly, aging can cause low testosterone. Unfortunately, for most women, as they age, their testosterone will decrease. Main signs and symptoms of low testosterone is going to be fatigue, no drive or motivation on a daily basis, low or no sex drive, difficulty building or maintaining muscle mass, and brain fog. So what are the solutions for low testosterone? You guessed it, get to the root cause. Figure out that root cause. If you can figure out what is causing the low testosterone, you can work to reverse it. So if you're on hormonal birth control and you think this could be the issue, you could stop your birth control. I'd recommend rechecking your lab work about 3 months after you stop hormonal birth control, once your levels have sort of regulated, to see if this has addressed the issue. If you have been dieting for a long period of time, stop dieting. Actually go into a gaining phase where you are putting on body fat, and this in itself could improve your testosterone levels. So back to my personal story, I had spent many years, about 12 years on hormonal birth control. So that was my number one hit. Number two hit, most of my teenage years and early 20s, I spent dieting or at least trying to. So there were two big issues that I think was causing my low testosterone levels. So I came off of birth control. I did my best to increase my levels naturally. So I went into very long off season, increasing my calories, trying to build as much muscle as possible and fix my hormones. This did help some, but I had a lot of symptoms of low testosterone. So after many months of being in a building phase, I had my hormones rechecked, and unfortunately, I still had very low testosterone. So I did opt to start on low-dose HRT. That is helping me to optimize my hormone levels. My testosterone is now in an optimal range. Not super physiologic, so I'm still within a normal range for females, but it has 100% reversed all of my symptoms and has really helped me make so much more progress in the gym and aesthetically in the last 2 years, more than I ever had 10 years prior. So thanks for listening, ladies. If you do need help addressing your hormonal issues, I have an all-inclusive program, so that is going to be addressing your hormonal issues from lifestyle. In addition to that, we are very closely monitoring your hormone levels with lab work, again, included in your program. And if we get to a point where we feel that prescriptions are needed to help balance you hormonally, I can do that as well. Send me a message if that's something you need in your life. Thanks, guys.